right, let the record reflect. State's President, Defense Counsel, defendant are all present.
Yeah, I don't, Judge, I don't know if the state thinks it's necessary, but with the experts, it's a little bit unusual because they can all be in the courtroom while the other one's testifying. I don't know if you need to tell the jurors that's all right because none of the other witnesses, they had to go out and call the other witnesses in here.
I wouldn't ask for any kind of instruction or.
I mean,
That's fine.
it's up to you. I mean, if you're asking for an instruction on.
I don't really, I just thought I'd bring it up. I don't know if it crossed the state's mind or not, but that's fine.
Okay. So the rule of sequestration is still invoked, though, correct?
At this time, it doesn't matter because our experts are able to sit.
Right.
And listen, so.
Right.
I'm just saying.
Those are the only witnesses.
Those are the only witnesses that are left. Okay. And then you can be seated. Go ahead. I'm sorry. So what, scheduling-wise, two things. One, I need to have that discussion with Mr. Wilson about whether he wants to testify or not testify. I'll do that in a minute. And then second of all, how long do you think your presentation will be with your experts? Will we go past the lunch hour, in other words?
Oh, yes.
Okay, very well. And then do you think we'll get through one witness prior to lunch, and then we can break for lunch and come back and do another, or?
Yes.
Okay.
That's what I anticipate.
Okay.
And then they have a doctor.
Certainly.
Dr. Hercott.
Certainly. When do you want to do a charge conference on the final instructions?
When do we want to do that?
I think after our expert testifies.
Okay. All right, then. Are we ready, then, for the defense to begin their presentation?
Yes, sir.
All right. And state's ready? All right. Ready to bring the jury, then. Go ahead. Please be seated. And Mr. Shirley, you may proceed.
Thank you. We would call Dr. Eisenstein to stand.
If you'll just face the clerk, raise your right hand, she'll swear you in.
Do you solemnly swear or affirm that the testimony you give will be the truth, the whole truth, and nothing but the truth?
I affirm.
Thank you.
Please, what's your step?
Good morning.
Good morning.
Are you all set up?
Yes.
Okay. Please tell us your name.
Dr. Hyman Eisenstein.
You said Dr. Eisenstein. What is your profession?
I am a licensed clinical psychologist, PhD.
Do you have a specific area of psychology that is the primary focus of your employment?
I'm a clinical psychologist with a specialty in clinical neuropsychology and forensic neuropsychology.
Would you please tell the jury what neuropsychology is?
Neuropsychology is the study of brain behavior, what the brain is capable of doing, normal, abnormal, the functional, it's the behavioral cognitive assessment of brain functioning.
How does that differ from just regular psychology?
So regular psychology studies abnormal behavior, doesn't specifically study brain functioning. So this really just zeroes in on brain functioning.
Okay. Can you give us a brief background of your education that was required of you to become a neuropsychologist?
So my PhD from the University of Health Sciences, Chicago Medical School. I graduated in 1982. I completed an internship at Fairfield Hills Hospital, which was a large state psychiatric hospital in Newtown, Connecticut. After that, I completed a one-year postdoctoral study at Yale in the West Haven VA, the seizure program that specialized in neuropsychology. I continued to working at Fairfield Hills Hospital. I was on the forensic unit for the next 4 years. That was an all-male forensic unit. We moved to Florida in 1986. I was the head psychologist of the head trauma program at Sunrise Rehabilitation Hospital. After that, I went into private practice. I worked on staff hospitals as a consultant. Several hospitals have closed, but Mount Sinai Hospital has remained open, and I've been on staff for almost 40 years.
Are you licensed by the state of Florida?
Yes, licensed in the state of Florida. And I also have my diplomate from the American Board of Professional Neuropsychology.
All right, educate me. What does that mean?
So diplomate status means that amongst one's colleagues, you're considered to be proficient at the highest level possible, and this is in the area of clinical neuropsychology, again, the study of brain behavior, and it's an assessment and validation with the highest level in terms of clinical achievement.
Is that a state award or is that a national award?
That's a national award.
And do you have any idea how many people have achieved this level of competence?
I think about 1,500.
Occasionally, are you retained to do examinations and provide opinions in cases such as this?
Yes.
And how many times have you done that?
I've probably evaluated about 150 individuals on capital cases, maybe a little more.
Okay. Have you also worked in the federal system?
Yes.
And in what capacity?
I've also evaluated individuals in clinical forensic, neuropsychology in the forensic area as well, in the federal area as well.
Okay. Now, you were retained or you were appointed to assist the defense in this case, were you not?
Correct.
And you agreed to work under the rates promulgated by the JAC, a state agency, is that correct?
That's correct.
So how much are you being paid per hour for the work that you've performed on the case?
$300 an hour.
And that's what the state agrees to pay you, is that correct?
That's correct.
And you're willing to take that?
Correct.
Do you know about how many hours you've devoted to this particular case?
Well, I've billed so far 31 hours, but additional hours have been spent in this case.
Have you always been retained by the defense in these types of cases?
Yes.
How did you first become involved in this case?
I was first, there was a request for an order by the previous lawyer, Mr. Jaffe. This goes back over a year. And Mr. Jaffe was going to appoint me, but the order was never signed by the judge. At that point, he withdrew, and then new lawyers came on the case. So new orders had to be assigned. So that's when you and your Mr. Hollander got involved in the case.
And Ms. Perez?
And Ms. Perez, correct.
Did you have a chance to go over any materials generated by either a law enforcement agency or another investigative agency to bring you up to speed as to what the allegations were against Mr. Wilson?
Yes.
And what did you review, if you recall?
Well, there was the criminal investigation reports, basically interviewing individuals in terms of the background and connection, affiliation with this particular case.
Okay. Did you have a chance to ever meet with Mr. Wilson?
Yes, I did.
How many times have you met with Mr. Wilson?
So I met with Mr. Wilson on 3 occasions, June 18th and 19th, for a total of 7 hours.
Okay. Were you able to obtain other background information pertaining to Mr. Wilson, such as jail records or other medical records?
Correct.
And Do you know how many pages you had the opportunity to review?
There were hundreds and hundreds of pages from the Department of Correction, mental health, jail records that I reviewed.
Okay. And is there anything that you specifically recall at this time having read that indicated to you that Mr. Wilson may have mental health issues?
The records going back over 10 years were indicative that Mr. Wilson presented with numerous psychiatric, psychological symptomatology. He was on a variety of different psychotropic medications. They tried many, many medications. He currently is on medication, lithium and Celexa. Both those are psychotropic medications.
What do you mean by psychotropic?
Psychotropic are medications that deal specifically with major mental illness, either psychosis or depression or a combination of both. He's been treated for these conditions for over 10 years, reflective in the records.
Do you recall any specific diagnoses, medical diagnoses?
He's been diagnosed with several different bipolar. He's been diagnosed with depression, anxiety. He's been diagnosed with schizophrenia. He's been diagnosed with antisocial personality disorder, adjustment disorder. There's a variety of different diagnoses that have been offered in the records.
Okay. Did you have a chance to talk to, in enhancing your background information, did you have the opportunity to talk to any other individuals related to Mr. Wilson?
Yes.
And who was that?
So I spoke to his mother and father, Mr. Steve and Miss Candy Wilson, and I also spoke to his sister, his oldest sister, Dr. Wendy Wilson.
Okay. As a result of your conversations with these individuals, did you obtain any background information as to Wade Wilson's progression through life?
Yes.
And what information did you obtain that you felt was useful in reaching your ultimate diagnoses?
Mr. Wilson was adopted by Steve and Candy Wilson almost after birth. Both the older sisters, Wendy and Whitney, are the biological daughters of Steve and Candy Wilson. And through a church gathering, they found out that Mr. Wilson's mother, biological mother, was 14 years old, had mental illness, had medical issues, and was unable to care for Wade Wilson. Shortly thereafter, they adopted him and became part of the family, the unit of the two older sisters and Mr. Wade Wilson, the youngest.
In Mr. Wilson's younger years, were there any, did they express any concerns about his mental health, or was he average?
So throughout his younger years, up through puberty, he was functioning fine. He was active in sports. He was part of the family.
Did he go to church?
He went to church on a regular basis. And for the most...
How was he as a student?
He was a good student.
All right. What happened after puberty?
So they found that there was a dramatic change that occurred in puberty. His mental health changed. His behavior changed. He became reclusive, paranoid, mood swings, very aberrant behavior. He would sometimes think that there are people aliens out to get him. very concerned about the family, the parents, and he became very disruptive and very, very difficult to manage.
Did he start experimenting with controlled substances?
Yes.
What type of help did the family try and get for Wade Wilson when they first started noticing these behaviors?
So they tried to get mental health treatment. They sought out psychologists. Mr. Wilson was not cooperative and very difficult in terms of trying to get him the help that they sought. And unfortunately, it was only through the police, when his behavior became destructive, that intervention finally occurred.
There's a terminology in our system called the Baker Act, where people are involuntarily placed in a mental health facility. Was that process utilized for Mr. Wade Wilson?
Yes.
And how old he was when that occurred?
I think he was about 15 or 16, and he was Baker acted.
Did that term of involuntary placement, did that result in any corrective action of his behaviors?
No.
Do you recall reviewing anything else in order to assist you with your ultimate determination and diagnoses?
I did review a letter from Dr. Wilson.
May I approach the witness?
You may.
Let me show you what's been marked as our Exhibit A, just for purposes of identification at this point. Do you recognize that document?
Yes.
Is that document an accurate reproduction of the letter you received from her?
Correct.
Now, let's get to the testing of Mr. Wilson. You're armed with this information, and you go to see Mr. Wilson, and your profession utilizes testing, does it not, in order to assist in diagnosing a mental health issue?
Yes.
All right, let's go through the tests that you asked him to perform. What was the first test you did?
So the first test I gave him was it's called the TOM test of memory malingering.
What's the term malingering?
Malingering is a state where somebody tries to fake, they try to embellish, they try to give responses that are not true responses, not accurate responses, not honest responses. The term that we use is malingering, or faking or lying. So as neuropsychologists, we want to make sure that every test that we're giving, the individual's really trying their best. They're giving their best performance, their optimal performance. So we have now utilized several different what's called malingering measures to test to see whether or not the individual is really putting forth full effort.
And can you, excuse me, can you describe the test itself?
So this is one test. Again, there are several malingering measures that were used. This is called the test, again, of memory malingering. The individual is shown 50 pictures, and then they have to, another set of 50 pictures are shown, one of the 50 pictures that they just saw, and an extraneous picture. And they have to identify the picture that they saw.
Let me interrupt you 1 second. All of the tests that you asked him to perform, are these tests that are accepted industry-wide amongst neuropsychologists?
Correct. These are all standardized tests. There's norms meaning that each test, the number are based on the averages. They're based on if they're above, below average. It's called standard deviation. Again, how much these scores deviate from the mean, the average. So yes, every single test is based on normative data.
Okay, you didn't design any of these tests yourself?
No, I did not.
Okay. I interrupted you, and I'm sorry. How did he perform on that first test?
He did perfect. The test was given 50 items. He recalled all 50 items. Again, the 50 items were shown. Again, then after that, 2 items were on the next 50 cards. He chose all 50 correct. And then half hour later, without repeating the 50 items, but with 2 items on the cards, again, his score was perfect, 50. So he got 50, 50, 50, perfect scores.
What did that tell you about how he was trying to do on the tests?
So it was my understanding that that Mr. Wilson was really trying to perform his best. He wanted to show me how well he can do on these tests, and that was certainly, I complimented him. I told him that his performance was very good. He was putting forth full effort, and that's exactly, as a neuropsychologist, one wants to assess that they're honest and they're putting their full effort. And after the battery of tests, then I can make a determination where there's strengths and weaknesses, there's high points, there's low points, and what deficiencies may exist.
Before you started the first test, did you have some concerns as to whether or not he was going to take any tests or how he was going to perform on the malingering tests?
Yes. So knowing a little about of some of his background from Ms. Perez, it was questionable whether or not Mr. Wilson was actually going to be willing to participate. Initially, we met in a room, an open area. There was a desk and chairs, and the officers stated that they have to remain in the room the entire time. 2 officers have to remain in the room the entire time. Mr. Wilson raised issues of confidentiality. One of the issues certainly with taking any type of psychological, neuropsychological test is that it's performed in confidence. I agreed with him. I said, you're right. There's no reason why the officers need to be here. So then Ms. Perez came up with the idea that let's go to the attorney interview room where there was a glass separating Mr. Wilson and myself.
Okay. Now, in order to perform some of these tests, does Mr. Wilson have to actually be able to access the documents that you're referring to?
Yes, he does.
And the new room, was that able to accommodate you in your effort to have him have actual contact with these documents?
So fortunately, there was a 2-inch slit at the bottom of the glass that I was able to pass through different items, different material that he was able to respond or to take in order to participate and fully evaluate his ability to take the various different measures.
But that small gap doesn't necessarily accommodate the materials in every test that you would want him to perform. Is that correct?
That's correct.
Okay. And were you also familiar with Dr. Mark Mills?
Yes.
Were you aware that Mr. Mills had gone in to see him before you?
Yes.
Okay. You told us about the first test. Talk to me about the next test, please.
So on June 18th, I also performed the Dellis-Kaplan Executive Function System, the trail-making test, 1 through 5. What is noteworthy on this test, and I think this is part of his mental status, how Mr. Wilson, how his mind works. He's very impulsive, he's very fast, and he has accuracy at the beginning, but it very quickly waxes and wanes. So on these tests, which are time...
Is there a term that you attribute to this, like perseveration?
Right, so perseveration.
Perseveration, thank you.
Right, so that's a test that I'm going to be talking about, which I performed on the second day.
Okay, I'm sorry, you go ahead then.
But what's noteworthy is on these measures, he scored all within the normal limits. These are very short in terms of 1 minute, maybe a little more, but he's able to focus his attention for very short periods of time. And he did well on these tests, but on other tests, even given the same day on fluency, he starts out okay, but he rapidly declines.
What do you mean by fluency?
So the fluency test was 3 different measures that asked him to do either letter fluency or category fluency or switching.
I think the jury might want to hear exactly how the test is performed, because these terms keep coming out and they need to hear physically what you're having him do in order to complete the test.
Okay, so just going back for a second for the trail making test, the first condition was just to cross off the 3s on the sheet, and he did fine. He completed this in 15 seconds, very fast. The second condition was to follow numbers in sequence, and again, he completed this in 30 seconds. Again, his performance was fine. The third was letter sequencing. Again, just the letters in order, and again, he did this in 26 seconds, very rapidly. The third was switching between number letter, which is a complicated task, and he went back and forth through some of the same numbers, but he completed this in 49 seconds. Again, very rapidly. And the third was just going through following the dotted lines. Again, he did rapidly, 18 seconds, he completed the task. So he did quite well on these conditions of very rapid, quick abilities. The next test was letter fluency, where I asked him to tell me as many words he could generate with the letter F. And this is, again, in 60 seconds. And he got 12 words. With the letter A, he got 13 words, and the letter S, he got 16, and then this task was within the normal limits. The breakdown came on the next, which was category fluency. He did okay in the first 15 seconds, the second 15 seconds, but by the third 15-second segment, he only came up with 1 word, and then his mind went blank. No more responses. And similar with boys' names. He was able to do okay in the first, the second, and even the third, but it tapered off. And by the fourth 15-second segment, again, his mind went blank, and the total score here is in the borderline range.
What do you mean by borderline?
So borderline is a score that is equivalent to an IQ of 70. It's already the lower percentile in terms of one's functioning. So one sees over here that there's some major decline in terms of how his mind is able to process information.
Okay.
And then in the last test, which is category switching, again, the first 15 seconds he was okay. It diminished the second, the third, and then by the fourth 15 second, again, no response. Again, this is a borderline 75, where, again, there's a diminished capacity over time.
Do you think he was malingering on the last test, on both of these categories, and that he did so poorly?
So one may have suspected that that could have been a possibility. However, throughout his performance on the entire battery, it came to a point where he did quite well in the beginning, and then over time, he just couldn't respond, didn't respond, and was not able. So that was a pattern that was throughout the testing. So I do believe that he tried, and yet somehow his brain is able to go like, in a car, he could go like 0 to 70 in a few seconds, but then he couldn't sustain that. He couldn't keep that level up, and then rapidly went back down to 0.
Okay. Did you have him perform any other tests?
That was what I completed on the first day of testing
All right.
on June 18th. On June 19th, the next day, it's Wednesday, last Wednesday, I did another malingering measure to start out with. This was called the word choice. The individual is shown 50 words on a card. Each word is repeated. I say it out loud. And they have to respond whether it is either natural or it's man-made or it's natural. That's the instructions on the test. After the 50 words are presented, then the individual is given a card with 2 words on it. One of the words was the correct and the other was an incorrect word, and they have to correctly identify the word that was stated.
All right, now I'm a little confused. What do you mean by one was a correct word and one was incorrect? Was it spelled incorrectly or was?
No. So, for example, one of the words, let's say, was bird. And then he would respond, is bird natural or is that man-made? So Mr. Wilson said, bird is natural. Let's say another word, lightning. Again, it's on a card. I say lightning, and then he has to say, is it man-made or is it natural? And he would say, it is natural. Another word, just to give an example, game. And he would say, and I would say game, and then he would say that's man-made. So 50 words like that are presented. After the 50 words are presented, then he's given a card. On the card, it has 2 words, crib and bird. And he responded the correct word by saying bird, which was one of the words that I said. And you go through, there's 50 words. His score was 48 out of 50. He made 2 errors, but still that is considered to be in the normal limits, and again, indicative that he's not malingering. He's not looking to say the wrong word. He's not looking to fake and to be disingenuous or try to say the incorrect word.
Okay. Continue with, how did he do on that test?
That was fine. That was
That was a 48 out of 50?
right, correct.
Okay.
The next test that I gave him was the ray complex asterisk figure. He had to copy a figure. The figure is a complicated design.
Tell the jury what it's comprised of. I mean, is it a log cabin? Is it a deer? What is it?
So this is what the picture looks like. It's a little small, but obviously without the numbers. This picture is given to the individual. They have to copy the picture.
Do they get to copy it while they're looking at it?
That's correct.
Okay.
And this is his copy. So his copy, as you can see the difference between the original and the copy. The copy is right in front of him. This is a copy that has many distortions, what's called graphic distortions. The copy is inaccurate. It reflects what's considered to be a right hemispheric parietal occipital lobe impairment. When you see this type of picture in terms of the inability to copy something to such an extent with such major distortions, it raises issues in terms of the graphic, the motor, the visual, the sensory. There are many, many skills involved, and the picture is just a distortion in many ways of the original. And this is moderately to severely impaired in terms of when it's scored on normative data. Again, there's individual scoring in terms of getting it.
Yeah, and how do you score something like that? Is that subjective? Is there an objective standard?
So there's an objective scoring. For example, there's 18 different elements, and for number 1, cross upper left corner outside of the rectangle. So there's very specific criteria how you score it. It's either scored 2 points, 1 point, half a point, or no points. So again, based on his performance, he got 23 out of 36 possible points.
Where does that put him on the scale?
So that was 2.4 standard deviations below the mean.
Okay, now you're going to have to explain that. Well, maybe not. Maybe you just need to explain it to me. What's the mean?
So the mean on every test means the average. That means the average would be how many people would score in this particular range, in the average range.
You said he was 2.4 deviations below that?
That's correct.
Okay, oh, so what percentage of the people testing would that put him into?
Well, that would put him very low, the lower percentiles. We can talk about psychometric equivalence. We're trying to just compare, to simplify apples to apples. In other words, 100 is the average. Each 15 points, and I'll talk about that soon in the IQ, it goes one standard deviation above and below. And the same thing in any other measure. We talk a standard deviation means that there's a certain percentage of the population is below. 2 standard deviations would be like a 70, which is borderline, and below that is even lower. We're talking about the very low end of the population.
And you said that it indicated to you what could be an issue with what part of his brain?
Well, usually the right brain, which is the nonverbal brain, and that would be considered the occipital parietal lobe. Again, sensory ability, graphic distortions, and this type of performance in of itself, I will never make any conclusions based on one single test, but it's accumulation of all the tests, all consideration, the entire profile. But certainly this is a red flag in terms of there's something really deviant about his ability here.
Okay. Now, you used the term deviant. You mean deviation as not deviant as in evil or something like that?
That's correct.
Okay.
Yes.
All right.
And then I gave him the half-hour delay recall, which was missing elements.
So was that drawing supposed to have been done based upon the original drawing that you showed him, that you just showed the jury?
That's correct.
But that had the element of memory in it because he didn't have the original drawing in front of him.
That's correct.
Okay.
Right.
All right. And what were his results in that test?
So because one expects that one will not remember over a half hour, there's going to be a memory decline. So it was only 0.75 standard deviations. It was less than 1 standard deviation. So on a relative norm, this performance was better compared to the original, although it's missing elements. But at least what he did remember wasn't as distorted. So there's elements here. I mean, there's some distortions, but still he was able to get mostly the main items. I mean, not all. Mostly he didn't. He got only 10 out of the 36 in terms of scoring. And yet, again, there's consideration given because there's a half-hour delay. The next was the IQ, the Wechsler Adult Intelligence Scale, 4th edition.
Some of these tests are like a 4th or 5th edition. Obviously, as time goes on, do they make modifications to the testing procedures?
Right. So the WACE, the Wechsler, has been modified 4 times already, maybe 5 times, every 10 years or so. And I'm sure they're in the process of redoing the test. The norms are updated. There's new questions. The test becomes more sophisticated in terms of statistical analysis. So it's an upgrade each 10 years or so in terms of the performance on the test.
I think you've already told us that all the tests you asked him to perform are widely accepted in your field.
Right. So the Wechsler Adult Intelligence Scale is the gold standard. I can mention that in the jail records, the DOC records, they gave him the Beta, which was a screening device, his IQ came out always around 100, maybe a little low, 98. That was done a few times. But the Wechsler Adult Intelligence Scale is the gold standard for intellectual assessment.
Okay, now it tests several areas, does it not?
Correct. So the test is divided into several different subtests. His performance is both on the verbal and the performance. There's attention, concentration, processing. It's broken down into, again, different elements, and ultimately there's the full scale is obtained. As I mentioned before, Mr. Wilson did okay in the beginning of every single test, but then as it became more difficult or as it became more complex, he said he couldn't do it. And even though I tried to encourage him, sometimes I was able to encourage him to do more, sometimes I was not able, and the complexity of the test made it difficult for him to do it, even to try, and that's when he said, I can't do it. So that happened many times throughout this IQ test.
Okay. What were the final scores or results?
So the full scale IQ is 92. 92 is the 30th percentile. It's the lower end of the average range. The average range goes between a score of 90 and 109. So this score is really a composite of 4 different subtests.
Did he express, or did he score lower on some sections than others?
Yes. So the highest was verbal comprehension. That was just verbal, which is his strength, and that was a score of 98. That was at the 45th percentile.
That would be the left hemisphere.
That's correct,
Okay.
more or less.
Okay.
On perceptual reasoning, which is the nonverbal, he scored 77, which is in the borderline range, at the 6th percentile, and a 21-point split between the verbal and the perceptual, which is significant. That's statistically significant, a 21-point split, a discrepancy. Working memory was 95, that's average, and processing speed was 108. That was his highest score. That was in the upper end of the average range at the 70th percentile. So a few things. First of all, the fact that he had done so well in processing, which again is quick, fast, repeating digits, forward, backwards, he did very well. And short, very short items, very quick. Mr. Wilson is very good. Gave me his full performance, his best performance. But the discrepancy between the processing speed and perceptual reasoning is 31 points. That's over 2 standard deviations between these 2 scores. And I refer to discrepancies in IQ as cognitive dysregulation. And
What does that mean?
what I mean by that is one expects that IQ, when it's given, both right and left hemispheric skills should be more or less equal. One expects there shouldn't be such discrepancy between different skills. One should be able to do both of them at their best ability. And when there's such discrepancies between different skill levels, one suspects that there may be something that is going on in terms of their brain functioning that could explain why is it that on some areas he's functioning quite well, and other areas he's quite poor. So that's what I refer to as cognitive dysregulation. Again, statistically, this is significant in terms of the differences, and these discrepancies are to be noted in terms of the overall analysis as to why this is occurring.
Okay. Did you ask him to perform any other tests?
Yes. So I asked them also to conduct the Wide Range Achievement Test, 5th edition. It's an achievement test. And his scores were basically normal in the average range. Word reading was 104, spelling 100, sentence comprehension was 110. That's all greater than the 12th grade level. So consistent with the fact that he completed high school, he obtained his GED. These scores are all consistent. Math computation was the lowest, 87. He has difficulty with math, and that was at a grade equivalent of 6.1. And that's consistent with, again, his transcripts and records in terms of his math abilities. Now, probably the most significant test in terms of neuropsychological functioning was the Wisconsin card sorting test.
Yeah, explain to the jury what that test is.
The Wisconsin card sorting test is a test of executive functioning.
What do you mean by executive function?
So frontal lobe ability, the front part of the brain, right here. This is the frontal lobes. If you put your fingers right over here, this covers the whole frontal lobe. The frontal lobes are the executive functioning that we all have in terms of decision-making, problem-solving, ability to stop and to consider different options, to think. Every one of us needs our frontal lobes on a daily functioning. Very simple example, like you're sitting and you're crossing the street. There's a red light. The red light tells you to stop. The green light tells you to go. So you have to use your frontal lobes to understand and recognize that red means stop, green means go, and to figure out that that is for one's safety, and one should wait until it turns green, whether you're driving or walking. Again, that's a frontal lobe activity, simply to process information, to weigh it, to look at it, and to understand, obviously, the benefits and figuring out that how that can ultimately be beneficial for the individual. That's on a very simple level. But the frontal lobes are needed for every activity that we do in our daily lives.
Okay, and how does this test measure that?
So, so this test, the individual is given a set of cards, and they have to match the cards to either the color, the form, or the number. They're not given any instructions to how to do the test, but they simply have to, the examiner, myself, will say either you're right or wrong. They have to first complete 10 cards in a row with the color scheme, followed then by 10 cards in a row with the form.
What do you mean by form?
So it could be a cross, it could be a triangle, it could be a circle. Again, one has to match the card to the same form of the 4 cards that appears. And finally, the number, how many numbers of items are in the particular card, whether it would be, again, circles, there'd be 4 circles or three triangles. Again, one has to follow that pattern. Now, individual is told that they're right if they complete the set. And of course, again, the instructions are not given other than I'll tell you if you're right or wrong. So he got the first 10 right about color. He understood that almost immediately. The next was form. And what happened is he starts to get it correct, but then he's unable to sustain the mental processes to continue with the form. And then he goes back to an incorrect response. And this goes on and on. And that's what's called a perseverative response. Perseverative means that you perseverate on the wrong answer. There's a sequence that is required. The individual has to follow the same pattern in terms of their mind, in terms of their mental abilities to sustain the same answer in order to get it correct. And that's where he has, there's a breakdown in terms of the mental functioning, and that's perseverative errors. He doesn't get 10 correct until almost half the test is completed of the form. So all the time, he keeps on getting wrong answers. And then he gets correct, then he gets wrong. This goes back and forth.
Okay. And now, you had color, you had form, and what was the last one?
It was color, form, and number.
Oh, and the number. You've already told us how he was doing on all three then.
Right, right. So the number, he did not get the number correct until almost the end of the test. He got that correct, so he got 3 total categories. But after number, it goes back to color. Mr. Wilson never got that concept. He couldn't figure out that you have to go back to color again. And at the end of the test, he committed 19 perseverative errors. So that was, at the end of the test, it was even worse than at any point of the test. The cumulative perseverative errors of 43 was 7.15 standard deviations below the mean.
And what did that signal you?
So this was profoundly impaired frontal lobe executive functioning skills. Just to give you an idea, the mean is approximately 7. It's a little below 7. In other words, 7 perseverative errors would be the mean. So his score of 43 was 7 times that number. This is a very aberrant score. This shows how his mental processes, how they break down. They are very impaired. His thinking processes are compromised. Again, information processing, the ability to profit from feedback, the impairment in terms of his ability to see through correct solutions to a problem. This is, again, a neurobehavioral, cognitive, and processes that is so way beyond the norm.
If Mr. Wilson were under the influence of a controlled substance, would you expect the results to be even worse?
Yes.
All right. Did you have him perform any other tests?
So the last test was the Wechsler adult, the Wechsler memory scale, 4th edition. This is a complicated test of memory. Again, it has visual and verbal memory. The test is very challenging, very difficult.
Based upon his prior test results, would you have expected him to do better on the verbal?
Well, maybe, but it's so complicated that even on this part, because there's a memory component here. So the memory component, for example, requires the individual, you read a paragraph, it's about 4 or 5 sentences, and then he has to repeat it. That was fine. He did the first paragraph somewhat okay. But then the second paragraph, again, a second story, the cognitive processes were overloaded. Nothing went in. In order to get something in terms of cognitive processes, you have to first get it in to your mental processes, and then you're able to rehearse it, get feedback, and have an output. There was no input whatsoever here.
And try and, if you can, describe to the jury what Mr. Wilson looked like or how he was acting during this process.
Well, he was very interactive. Again, as I mentioned, it was through a glass, but he stood up on the ledge. He made sure that I heard him. He was very attentive. He really tried his very best.
But I'm more curious about this last test.
Okay, well,
it's like he shut down completely.
Right. So yeah, right. In terms of that, yes. The first paragraph he was fine. The second paragraph he was totally shut down. No response. The same thing came in terms of asking him to draw pictures. Initially, he was okay. I showed him 5 different pictures, and he was able to do more or less, 4 out of the 5, and came to a half-hour delay recall. He only got 2 out of the 5. And then as the test progressed, the last one was a very complicated task of paired associates. You give a list of 14 words. They have to, you give 1 word, you go through a list of 14 pairs, and then they go through 1 word. Please give me the word that I just said. That's it. He was done. He was shut down, and he said, I can't do anymore. So this.
You draw a particular conclusion from his total inability to finish that test.
So what I was able to score all falls within the borderline range, very, very low. This just to show, this is a bell-shaped curve, just to give some idea of what we're talking about. The average is here 100.
That's the median?
That's the median. 70 is the lower percentile, the lower 2 to 3 percentile of the population. So this is where he falls on this particular test. Again, it's indicative where the task becomes more complicated, more complex. That's where there's a breakdown. So the breakdown is in terms of things that is somewhat easier or more manageable in terms of his mental processes, and then where it's more complicated and more sophisticated and certainly requires more cognitive, frontal lobe, executive functioning ability, that's when there's a complete total breakdown.
In doing your research and interviewing Mr. Wilson and others, were you able to determine whether or not Mr. Wilson had sustained any head injuries during his lifetime?
Yes. Mr. Wilson has a whole series of head injuries. Mr. Steve Wilson, the father, reported that at age 10, while playing baseball, he was running to catch a ball and smashed into a metal fence. His front tooth cracked, and he had a lump on his head. And he was a very good sports player. At age 11, playing football, he caught the ball from a kickoff. He was a safety return. He played many positions, but this time he was a safety return. And he was hit so hard that he was woozy and had a concussion. Then again, that was from his father. He played tackle football for 4 years, and he was hit hard, very hard, many times. He also played basketball. At age 18, he had a motor vehicle accident. He was sitting in the back seat without a seat belt, and the driver ran into a big tree. Mr. Wilson said, I remember waking up and it looked like everyone in the car was dead. He suffered a loss of consciousness and his head hurt, but he did not go to the hospital. At age 21, he had another motor vehicle accident. He was sitting in the passenger seat without a seat belt, and the driver hit a big oak tree. He blanked out for a few minutes and was taken by ambulance to Tallahassee Memorial Hospital. He signed out of the hospital AMA against medical advice. This was confirmed by both his father and his sister. His sister called the hospital and found out that they performed a CT scan of the brain and there was no bleeding. The mom reported that at age 20, Mr. Wilson overdosed on drugs and he had a grand mal seizure. An ambulance came and took him to the hospital. Again, the CT was performed, and the sister again reported there was no bleeding. The DOC records on 6/3/18 reported that he was jumped by 3 inmates and suffered a loss of consciousness for 1 to 2 minutes. the DOC jail records have what is called a head trauma protocol. They performed this protocol suspecting that he had loss of consciousness, and that is in the jail medical records.
Now, you're, oh, I'm sorry.
I'm just trying, just one final. The DOC records in December of 2021, Wade complained of chronic migraine headaches, and they performed another CT scan. So this is more recent.
Okay. Obviously, you're a neuropsychologist and not a neurologist, but after you had him perform all the tests, you interviewed all of these individuals, you compiled the information. What was your ultimate conclusion?
So my ultimate conclusion is that Mr. Wilson has neurocognitive brain impairment. Most likely right hemispheric and also frontal lobe involvement. There's enough data to support that his brain is not functioning like a normal, healthy individual. It's supported by the fact that he has multiple head injuries, and this is a synergistic effect. Each one is adds on in more than just a cumulative, but it's in exponentially, it's worse. And throughout his life, he's had multiple head injuries. And brain scans have been performed, although these are just CT scans, nothing more than that. This is also complicated, certainly by his drug usage over his life, as well as psychiatric conditions, which are numerous. And currently he's on medication. He's been on medication for many, many years to quiet his brain, to have his brain functioning, to try to have him at least at a state of ease in terms of his brain functioning, which he recognizes, and certainly the family recognizes, is abnormal.
But the efforts of Mr. Wilson, and more particularly his family, to correct this have been minimal.
That's correct.
I don't have any further questions. Thank you, Doctor.
Yes, Sharon, thank you. Good afternoon, Dr. Eisenstein. Or I guess good morning, for one more minute. Sir, I want to go through your background for a few minutes before we get into your opinions. You worked in a forensic unit for 4 years directly after completing your internships, is that correct?
Correct.
And during that time, you were mainly doing forensic work, so evaluations, finding if people are competent?
Well, this was a treatment unit, so it wasn't questions of competency, but it was more treatment.
Okay. Now, after that, you moved down to Sunrise, Florida,
Correct.
and that's where you were employed by a rehabilitation center.
That's correct.
During that time, you actually you were only employed by them for 1 year.
That's correct.
Then after that, you started doing contract work.
Correct.
You mentioned Mount Sinai Hospital, being with them for 40 years, but they don't employ you, correct?
That's correct.
So actually, all your work after you left that 1 year of employment was contract work.
That's correct.
So you would go to maybe a rehabilitation hospital, do an evaluation for them or some work for them, and you bill them by the hour.
Correct.
Now, at some point, you actually conducted an evaluation, and the defense attorney noticed your evaluation and asked you to testify in a capital case.
Correct.
And that was in the late 80s.
Correct.
Now, after you took that first capital case, you then started to take on more of those cases.
Correct.
And that became the bulk of your work.
Correct.
And so now it takes up 99% of your work. capital
No,
cases?
well, no, not 99%. I would say maybe more like 80%.
Okay. What's the other 20% then?
Well, as I mentioned, I do independent medical examinations. I work for insurance companies. I have a small psychotherapy practice, so it's a variety.
In your small psychotherapy practice you have probably 4 patients or 5 patients right now?
That's correct.
Now, you have testified over 150 times in capital cases,
Correct.
and always for the defense.
Correct.
Never once have you been hired by the state of Florida.
I was hired once, but that was after the defense. That's correct. But it's mostly for the defense. Correct.
And in almost every single one of these cases you testify in, you diagnose them with some sort of prefrontal cortex damage or some sort of brain damage, correct?
Correct.
And that's your main diagnosis in this case.
Correct.
Now, you began reviewing this case on June 4th of this year.
Correct.
You bill at the rate of $300 an hour.
Correct.
Now, prior to meeting with the defendant, you actually had gone through $10,000 worth of money. Is that correct?
No.
Okay. Well, didn't you have to actually request an additional $10,000 because you had already billed for $10,000?
Well, that's up until this point.
Okay. So you had billed up until this point for $10,000.
That's correct.
And you needed additional hours.
That's correct.
Now, if I did my math correctly, $10,000 divided by the $300 JAC rate means that you spent 33 hours and needed more hours, correct?
Well, it was 31 hours, and there was also travel time.
Okay. So you did 31 hours. Is that prior to testing?
No, that's including testing.
So 7 hours of testing
Correct.
and 24 hours of review.
Well, yeah.
Okay. So you spent 24 hours reviewing in addition to the testing.
Well, yeah, it's broken down to both the testing, the scoring, the analysis, the review of records.
Okay, well, prior to testing him and doing your work after the testing, you had already billed 31 hours, correct? Or you had 31 hours that you had performed?
Correct.
Okay, so 31 hours leading up to this point where you have to now test and analyze him.
Correct.
Now, you would agree that the review of the materials is important.
Correct.
Background information is important to the work you do.
Correct.
Now, you're not a medical doctor,
Correct.
and you're not a neurologist.
Correct.
So you don't deal with really doing CT scans or analyzing those types of brain scans that a neurologist may do.
That's correct.
Now, would you agree that part of the reason that it's important to review these materials and be familiar with them is to see how they mesh with your testing, to see if there's consistencies between everyday life and the testing you perform?
Correct.
So for instance, if you performed IQ testing on someone and they score 65, but you know from their school records that they're an AP honor student getting all A's, that would raise some red flags.
Correct.
Because someone who's doing that well in school shouldn't have a 65 IQ.
That's correct.
Now I want to go through the records you reviewed for this case. You mentioned you reviewed the medical records, which contain the mental health records of the defendant.
Correct.
Now, there are 10 years worth of records that you've reviewed.
Correct.
And no records are from any private psychiatrist or psychologist that outside of the jail setting.
Correct.
And in fact, you talked to the parents and you were unable to obtain any psychological records from them.
Correct.
In fact, it was just a 4-page, very brief synopsis of mental health issues that their son had.
Correct.
Now, in those jail medical records, you talked about how he's got all these diagnoses. I think you said, I'm not going to get all of the ones you said, but I want to just go through some of them. You said he was diagnosed with depression,
Correct.
anxiety,
Correct.
schizophrenia,
Correct.
adjustment disorder,
Correct.
bipolar,
Correct.
schizoid affective.
Correct.
All right, did I get them all?
I believe so.
All right, so let's talk about depression. Would it be likely that someone who's incarcerated, especially for first-degree murders, may feel a little depressed?
Correct.
is it common that someone who's incarcerated in that type of setting may feel anxious?
Correct.
And as far as schizophrenia, where in the records did you see that he had a diagnosis for schizophrenia?
You're correct. I'm sorry. It was schizoaffective.
Okay, so no diagnosis for schizophrenia.
Correct.
Okay. And you would agree that almost everything in the records is self-reporting by the defendant.
Well, it's the self-report and the analysis by the professional staff in the jail.
Okay, what analysis did you see by jail staff listing out symptoms and a basis for a diagnosis?
Again, I'm not sure that there was a listing of symptoms, but certainly there was a diagnosis, and there's been medication that has been throughout the 10 years, a variety of different medications. And medications are not given to every single individual in the jail system. So I think that one can look at the fact that there is medication is indicative of the fact that they acknowledge that there's certain conditions that warrant giving of the medication.
So you reviewed as part of these medical records, when a patient comes into the jail, they go through an intake process.
Correct.
And at that intake process, they're asked if they have any mental health conditions.
Correct.
And at that point, they can say, I have a diagnosis for depression.
They report it, and then the staff, whether it's the staff, if it's the psychiatrist on staff or the other qualified staff in mental health, they make that assessment.
I want to ask you about the DSM-5. Are you familiar with the DSM-5? I think there's a newer version out, maybe the DSM-5 TR.
That's correct.
You're familiar with this?
Yes.
And what is the DSM-5, doctor?
That's the diagnostic manual in terms of different psychiatric conditions and the basis to make a diagnosis.
And it's recognized and used by psychologists all over the world.
And psychiatrists, yes.
Now, in this DSM-5, there are very specific criteria that must be followed and must be present in order to make a diagnosis.
Correct.
And anywhere in the records, did you see a diagnosis in conjunction with the factors needed to make that diagnosis that are stated in the DSM-5?
No.
Now, you also mentioned that you reviewed investigative reports.
Correct.
Now, those were created by an investigator hired for the defense.
Correct.
And actually, in that investigative report, the defendant told the investigator that he was a heavy drug user.
Correct.
And that he had a diagnosis of attention deficit disorder.
Correct.
And you would agree attention deficit disorder affects the prefrontal lobe.
Correct.
You also mentioned that you reviewed his school records.
Correct.
It's a one-page document.
Correct.
It's a transcript of his high school years.
Correct.
And so this transcript of his high school years would be after he's having these problems with drugs and allegedly with mental health.
Right. During that time.
Because he started at 13, according
Correct.
to his parents. All right, so let's talk about his school records. You would agree that he got mainly A's, B's, and C's, but consistently struggled with math.
Correct.
And you would agree that in 12th grade, he got a B in math.
Correct.
And he got a couple C's, but the rest A's and B's.
Correct.
Now, doctor, you wouldn't say those are awful scores, correct?
No.
And in fact, did you see what his class rank was?
Yes, it was like about, he was half.
He was 133 out of 260, right?
So he's a little below half.
Okay, so close in the middle.
That's correct.
Now, you also indicated that you reviewed a letter from his sister, Dr. Wendy Wilson.
Correct.
She's a radiologist.
She is a pediatric radiologist. Correct.
Okay? And so I assume was a radiologist and then got her subspecialty in pediatrics.
Correct.
Now, she's trained as part of being a radiologist to review x-rays, CT scans, and other types of imaging.
Correct.
And you spoke to her.
Correct.
And you spoke to his adoptive parents,
Correct.
loving people,
Correct.
loving home,
Yes.
close-knit family,
Correct.
did everything they could for him.
Absolutely.
But they're unable to actually give you any details regarding his diagnoses from specific doctors or much detail surrounding his mental health.
Correct.
And they talked about this dramatic change when he was 13 where he became withdrawn, uncooperative, moody.
Correct.
Those also things that you might see with someone who begins using drugs.
Correct.
You also mentioned that he was Baker acted.
Correct.
And in all of the records you reviewed, and in all of your conversations with his family, he was only Baker acted one time.
Correct.
And that one Baker Act was related to his father finding drugs.
Correct.
And when his father found drugs, he called the police. Police came. Defendant ran from police. Subsequently gets Baker acted.
Correct.
And he actually is Baker acted not for multiple days. He's released the next day, correct?
Correct.
Now, did you review the statement made by Joshua Lukic, who called 911 regarding the defendant telling him he had just killed 2 women?
No.
Did you review the 911 call?
No.
So you weren't able to gauge whether the defendant had difficulty remembering the events of October 7th of 2019 when he talked to Joshua Lukic.
I did not review those.
And you weren't able to gauge whether he exhibited any signs of prefrontal lobe damage during that time when he was with Joshua Lukic.
Correct.
Did you review the statement of Stephanie Johnson, who was with the defendant throughout the evening and morning of the murder?
No.
And so you wouldn't know whether he was acting appropriately.
Correct.
And you don't know whether he was acting as someone who might with prefrontal cortex damage.
Correct.
Now, did you review the statement of Melissa Montanez and her interactions with the defendant on October 6th and 7th?
No.
Do you know who she is?
No.
She was the victim of the battery that survived? Okay. So you don't know whether he was acting as someone might with prefrontal cortex damage in his interactions with her?
Correct.
And you don't know whether he was exhibiting any signs of memory impairment in his interaction with Melissa Montanez?
Correct.
Now, did you review the witnesses' statements who viewed the battery that he committed on Melissa Montanez, either Shayna Williamson, Don Griffin, Amy Sablazian?
No.
So did you review the statement he made to Timothy McCormick after the defendant murdered Diane and Christine?
No.
Did you watch the video of his interaction with the officer?
No.
Don't you think his interaction with the officer might be important to gauge whether he was having memory issues or exhibiting any type of prefrontal lobe damage at the time?
Correct.
But you didn't watch that.
No, I did not.
Now, you also mentioned in your testimony about your prefrontal lobe helping you determine whether if the light's green, then you know you need to go. If the light's red, you know you need to stop.
Correct.
Correct? So if somebody was getting stopped by a police officer who had just committed 2 murders, they might think, it's time for me to go. Would that be a logical step potentially in someone who has just been caught for murder?
Perhaps.
Would you also agree that someone who is able to back into a parking space, that they would need their prefrontal lobe to be able to make that decision and then be able to do that?
Correct.
Now, did you listen to the defendant's statement where he confessed to the murder?
No.
And you agree that a detailed statement recounting the murders from 3 days prior would be difficult for someone to do who scored in the 2 to 3% range for memory?
Perhaps.
You think it might be important to listen to a statement the defendant made 3 days after the murder to gauge the defendant's cognitive function?
Correct.
But you did not do that.
No.
Now, there were also hundreds of emails that he sent to dozens of women. Did you review any of those?
No.
Would you expect someone who scores in the 2 to 3 percentile for memory to have a difficult time dialoguing with over a dozen women about various things and remembering the day-to-day of what he's talking to them about?
Perhaps.
let's move on to head trauma. You went through a series of events that you believe are head trauma. You said that when he was 10, he was running to catch a ball and broke his tooth on a metal fence and got a lump on his head.
Correct.
Okay. Is that also could be called a goose egg?
Maybe.
Kid falls down, hits their head, a little swelling, put some ice on it, kid runs off to play.
Well, it also could be a hematoma.
Okay, which is swelling with
Yes.
a little blood in.
Yes.
Okay, and they didn't take him to the hospital.
Correct.
Nothing seemed wrong. He was able to walk and able to talk and function.
Correct.
Now, at 11, he caught a football and was hit so hard he got woozy. Okay? Did they take him to the hospital for that?
No.
And again, he's able to walk and talk and eat, and there's no medical concern from getting hit with a football that will cause his parents to take him to get medical care.
Correct.
And you'd expect loving parents to take him for medical care if they had concerns.
Right. Well, I think also the concern for, especially now in terms of football injuries in 2024 is quite different than it was 20 years ago.
So let's talk about that. He wasn't in an NFL,
No.
and he wasn't some big-time football player.
Well, he played 4 years tackle football.
But that's not, I mean, he's not 4 years, right?
I'm sorry?
4 years is all that you know of. That
Well,
he
that's a
played.
long time.
Okay? But again, during those 4 years of football, there's no indication that he's having any kind of head problems or memory problems or cognitive problems that he needs treatment for.
Well, he's hit hard many times. He plays hard. So, again, it was a different era, a different time.
Okay, well, I mean, he's 30 years old. This isn't 40 years ago that we're talking about, right?
No, but we're talking 20 years ago.
Okay, so, but to my question was, doctor, was he ever taken for any kind of treatment as a result of any injuries he got in those 4 years of playing football?
No.
And you'd agree from the time a kid starts walking, they constantly are falling. Bumps on the playground, sports injuries, that's not uncommon.
Correct.
Now, you also mentioned with his head, regarding his head trauma, he got into 2 accidents. And that's according to the defendant, correct?
Well, both the defendant and subsequent, also the father and mother reported.
So let's talk about that first accident. Doesn't go to the hospital. Not taken to the hospital, correct?
Correct.
Second time he goes, he gets a CT scan.
Correct.
So they check out his head to make sure there's no injury, no bleeding.
Correct.
And actually, his sister, who's a radiologist and trained to read CT scans, reviewed that CT scan and confirmed there was no damage.
Well, I'm not sure she reviewed it, but she called and they said there was no bleeding.
Okay, so again, normal, no follow-up care.
Correct.
And when he was jumped in jail, there was actually a CT scan performed, and that was normal as well.
Correct.
And in fact, the only thing they gave him was Flonase.
Correct.
You're familiar with Flonase?
I'm not sure.
It's a spray to treat stuffy noses, allergies. Is that
Okay.
correct? You don't know.
Well, they did a head protocol on him.
All right, and
Head trauma protocol.
again, CT scan was normal,
That's correct.
and the only thing he gave him was Flonase.
Okay.
But you don't know, you're not sure what Flonase is. Is that what you're saying?
Well, I'm not sure exactly what they did at the time, but that's correct.
Okay. Now, at age 20, he actually overdosed and had a normal CT scan. Is that correct?
Correct.
So, as far as you're concerned, all the CT scans he's had are normal with no hemorrhaging, meaning no bleeding.
Correct.
So tell me, doctor, in your review of the records of the CT scans and of talking to his family, what history did you find of actual brain damage in the records?
So the fact that a CT scan was performed so many times on him with multiple head injuries. We know that the CT scan is a measure which basically tells you whether or not there's any bones which are fractured and whether or not there's bleeding. But it doesn't go beyond that. And beyond that, there was no test performed. But again, to the extent that there were so many head injuries and there are so many CT scans that were performed over time, as I mentioned, there's certainly a history of synergistic effect of head injuries that Mr. Wilson suffered.
Okay, let's talk about that. I want to break that down a little bit because it's a lot of big talk, but I want to break that down. So you would agree that if somebody goes into the emergency room or emergency department, as it's now called, if they were to go in and say that they bumped their head, you would expect a CT scan would be performed, would you not?
Perhaps.
There are certain protocols that medical doctors would follow when there's a reported injury.
Correct.
And you would agree that when someone gets in a car accident, there would be specific or certain protocol that professionals would follow to determine whether there was any type of injury.
That's correct.
So the fact that he's had multiple CT scans does not mean that he's had multiple brain injuries.
Well, the only reason they would do the CT scan is to follow the protocol of head injuries. So
Right.
he's had multiple head injuries.
Well, let me ask it this way. If somebody goes in and gets an x-ray for a foot that's injured and it's not broken, you wouldn't say that if they had 6 x-rays for their foot that it must mean they have a broken foot, right?
No, but what it would mean is the fact that there's indication that there may be some abnormality, something wrong, and there certainly could be some indication of residual problems.
But you haven't seen any evidence of issues with any of his CT scans.
That's correct.
So you're making an assumption that because he's had numerous CT scans, he must therefore have some type of brain injury because of these various falls or injuries.
Well, I'm just saying that the CT scans were performed because of suspected brain injury. The fact is that there's a history of multiple brain injuries due to a variety of different circumstances, and that is something that one certainly would make a consideration in terms of what their brain functioning may be.
Okay, so you're using the term brain injuries, but the CT scans don't support any brain injuries from what you've seen.
Again, there's no fracture and there's no bleeding, but that doesn't mean there's no brain injury.
Okay, but my question is, again, none of these records actually show a brain injury. There could be, but they don't show it.
Well, the test is as sophisticated as what it can do.
Okay, but according to the test that you are able to review, there's no,
Objection argumentative.
it's not
Okay.
answer the question.
You can ask your question.
The question again, doctor, is these CT scans, there's no evidence that you've seen of the brain, of any brain injury.
They were normal, that's correct.
So, some falls in sports, 2 car accidents, led you to the conclusion he suffers from synergistic head trauma.
That's correct.
And you believe that this head trauma plays a significant part in his brain impairment.
That's correct.
And again, you found no records of any evidence of brain impairment.
Objection repetitive.
Sustained.
All right, now I want to go through his demeanor when you're testing him. Do you see any signs of paranoia?
No.
Any signs of delusions?
No.
Any signs of hallucinations?
No.
Is it psychotic?
I'm sorry?
He wasn't psychotic.
That's correct.
No psychotic symptoms that affected your testing.
That's correct.
In fact, you had a discussion about his mental health.
Correct.
And he told you that he had struggled with mental health his whole life.
Correct.
Did he tell you he had struggled with behavioral issues?
Correct.
Did he tell you he'd been kicked out of school for selling drugs?
Correct.
He told you he was diagnosed with bipolar.
Correct.
He told you he had depression and mania.
Correct.
but he was unable to give you any specific examples of mania.
Correct.
And again, with the DSM, there are very specific requirements to be diagnosed as being in a manic state.
Correct.
And he didn't give you any specific examples of a depressive or disorder.
Correct.
And in fact, you didn't ask him any details.
That's correct.
You just took, again, what he was telling you.
And the records, correct.
And your job is to test his brain and his cognitive functioning.
Correct.
He also told you his mind wasn't working well.
Correct.
You didn't ask him to clarify what that meant.
Well, I mean, he said that his difficulty thinking, difficult with clear thinking, thought processes.
And that could potentially be from the medication he's on.
Well, it's possible, correct.
You took pretty much everything he told you at face value because your job was to be there for testing.
Right, and it's corroborated by the records.
And let's talk about the testing you conducted. You would agree that there were some tests where he got tired and gave up.
Correct.
So while you may not say he's malingering, that affected his scores on those tests because he got tired and gave up. He wasn't able to complete the test.
Well, I wouldn't use the word tired, but I would use that he was unable to complete those tests.
So him being unable to finish the test, or shutting down, or deciding to finish the test, that counts against him.
Correct.
You tested for memory issues, and you indicated he's in the second percentile.
Correct.
So out of 100 people, he's the second worst.
Correct.
How would you expect someone to function in their lives with this kind of memory impairment?
It's difficult.
You would expect that people might observe these things and it might be noticed by others.
Maybe.
Where in the jail records did you find issues of him not remembering things?
Not noted.
In fact, there's places in the jail records that indicate his memory's intact.
Correct.
His parents never reported memory issues.
Again, my testing was very specific. There's various different components of memory. Some of them are actually average, above average, and others that are quite impaired. So again, there's a breakdown of different tasks, different activities.
Sure, but his parents never reported memory issues.
Correct.
You also tested for working memory,
Correct.
and that involves, again, the prefrontal lobe
Correct.
cortex. And you found that on this frontal lobe executive functioning, no tests were normal.
Well, again, on complex behavior, that's where there was the greatest breakdown.
Okay, but you, if I recall, you stated in your deposition that every single one of these frontal lobe executive functioning tests were abnormal.
Correct.
Nothing further.
Just a couple of questions. Did you ask Mr. Wilson's parents for any records or anything that they may have?
Yes, I did.
And did they tell you that, as a matter of fact, their home had burnt to the ground by fire and took everything with it?
Objection outside the scope.
Overruled.
Did they tell you that?
Yes, they did.
So they don't have any records, not through any fault of their own, but they may have had some records at some point in time.
That's correct.
Now, his sister is a doctor. She's a pediatric radiologist.
Correct.
Do you know if she ever tried to help Wade by ordering any PET scans or MRIs or any more complex testing to determine whether or not he had any brain injury?
She did not.
In interviewing his sister and his parents, did you make a determination that at some point in time they had a very close and loving family?
Yes.
But that started to break down at some point, somewhere around 16?
Correct.
Now, the prosecutor asked you questions about whether or not his conduct was appropriate, Mr. Wilson's conduct was appropriate in making a judgment to back into a parking spot or to leave when a law enforcement officer showed up. Would you agree with me that his conduct certainly wasn't appropriate when he killed 2 women and beat another one?
Correct.
At some point in time, I think in your testimony you mentioned that you were informed that the biological mother had mental health issues.
Correct.
Did anybody get into the nature and extent of those issues?
The Candy Wilson mentioned that she was doing drugs while pregnant. And
With
that,
Wade?
yes. Yes.
But you didn't have a chance to talk to the biological mother, did you?
No, I did not.
So you don't know how severe her mental health issues were.
That's correct.
Is it possible that her mental health issues could have been passed on to her child?
Absolutely.
Now, the prosecutor also asked you if you had had a chance to see, read or hear any of Mr. Wilson's statement to law enforcement, and you told her you had not.
That's correct.
So you don't know whether or not he was telling the truth or lying, and it had played no part in your determination that he may have brain trauma.
That's correct.
It wouldn't be relevant in your consideration, would it?
No, my evaluation was independent.
Okay. So you wouldn't need input from all these other sources to make that evaluation?
That's correct.
I don't have any further questions. Thank you.
No, Your Honor.
All right, you can step down, sir. So, ladies and gentlemen, it is after 12:30. It's a good time to break for lunch. Wait for him to step down, and then we'll